Hello, my name is Kathy Flynn, and on behalf of the American Liver Foundation's Connecticut Division, it is my pleasure to welcome you to our educational webinar on alcohol-related liver disease. As you may know, the American Liver Foundation was established in 1976 by the American Association for the Study of Liver Disease. This organization of scientists and healthcare professionals was concerned with the rising incidence of liver disease and the lack of awareness among both the general public and the medical community. Our mission is to promote education, advocacy, support services, and research for the prevention, treatment, and cure of liver disease. I welcome you to this webinar and invite you to become engaged with the American Liver Foundation. Thank you for joining us today. Donna Shaka, the Connecticut Division's Community Outreach and Education Manager, will now take over to introduce our featured speaker.
Thank you, Kathy. Dr. Julie Spivak is a gastroenterologist in Connecticut and is affiliated with multiple hospitals in the area, including Bridgeport Hospital and St. Vincent's Medical Center. She received her medical degree from Albert Einstein College of Medicine of Yeshiva University and has been in practice for more than 20 years. Dr. Spivak has a bachelor's degree in neurobiology from Yale University and earned her medical degree at Albert Einstein College of Medicine. She is interested in all areas of gastroenterology, but is a specialist in hepatology, women's issues in gastroenterology, and screening colonoscopy. She is a member of numerous professional societies, including the American Medical Association, the American Gastroenterology Association, the American Society for GI Endoscopy, and the American Medical Women's Association of Fairfield County Chapter. It is my pleasure to introduce Dr. Julie Spivak to share information about alcohol-related liver disease.
Thank you, Kathy and Donna. It is my pleasure to be a part of this presentation and to give this presentation. I thank you for asking me. So, as it says, we're going to talk about alcoholic liver disease. Before getting into specifics about alcoholic liver disease, I want to define the overall spectrum and the impact alcoholic liver disease has in the United States. I think most of us have been touched by someone throughout our lives who may have had a problem with alcohol dependency. So it's extremely prevalent, but it does account for more than 12,000 deaths per year. And alcoholic liver disease is the second most frequent indication for liver transplantation. Presently, the most frequent is hepatitis C. But soon, with hepatitis C being eradicated in the not too distant future, alcoholic liver disease and fatty liver disease will be the most frequent indications for liver transplantation. And interestingly, in terms of the spectrum of alcoholic liver disease, it goes through several stages. And the first stage is fatty liver, which is really indistinguishable from non-alcoholic fatty liver disease, which we'll talk about a bit later. The next step is alcoholic hepatitis, which is active inflammation in the liver, and then the next step after that is cirrhosis, which just means a lot of fibrosis or scarring in the liver. And the final thing that can happen after someone has cirrhosis is a liver cancer can develop, a primary liver tumor can develop in the liver. Now, people don't have to go through all of these phases. One can start with fatty liver and end up with cirrhosis without ever having alcoholic hepatitis. And certainly people can have cirrhosis and never have liver cancer. So alcoholic liver disease, when does it occur? We really need to define the scope and what is alcohol dependency, what is too much alcohol. So you'd be surprised at how little alcohol it takes, how few drinks it takes to be considered excessive drinking, and to be enough drinking that it could cause liver disease. So in men, more than 4 drinks a day or 14 a week. So if someone's just having even 2 drinks a day, but every day, so there's 14 drinks a week, you can have alcoholic liver disease. And for women, it's even less than that. More than 3 drinks a day or just 7 drinks a week, which really, as we can say, goes to only 1 drink a day every day would be enough for a woman to potentially end up with liver disease. So the important thing is really knowing, though, what is a drink. I think everybody has a different idea in their mind, and the official medical definition is 1 standard drink has 14 grams of alcohol, and that is what your liver is seeing, those 14 grams of alcohol. So what is a standard drink? And if you learn anything from me today, there's really going to be 2 things. But the first thing is that a beer is the same as wine, is the same as a hard drink in terms of your liver and what the amount of alcohol your liver sees. And that's because the volumes are different. So 12 ounces of beer is equal to 5 ounces of wine, which is equal to 1.5 ounces of hard liquor. And so it doesn't matter. I do hear from people all the time, but I'm just drinking beer, I'm just drinking wine. As far as your liver is concerned, they are all identical and they can all cause the same liver disease. So that to me is one of the most important things to take home from this today. And then the next thing will come up very soon as well. So moving on. So how do we even know if someone has alcohol dependency? There's something called a CAGE assessment, and this goes back many, many years, and it still is considered the preferred way of determining if someone does have a problem with alcohol dependency. So CAGE stands for an acronym is, have you ever tried to cut back on your use? Have you ever been annoyed or angered when questioned about your use? Have you ever felt guilt about your use? And finally, have you ever had an eye opener to get you started in the morning? So if people can answer yes to more than 2 of these, so really 3 questions, if you can answer yes, that will pick up about 71% of people who have alcohol dependency. So it's quite sensitive, just those 4 questions. So it really is quite easy to help figure out if someone has alcohol dependency. We just have to ask the right questions. So as I said before, alcoholic liver disease is a spectrum going from fatty liver all the way to cirrhosis. Many factors contribute as to whether someone will go on to cirrhosis. So comorbid liver diseases or even just general medical diseases like obesity or hyperlipidemia, hepatitis C, hepatitis B, and certain genetic factors may accelerate the development of alcoholic liver disease. The first step, as we said, is fat in the liver when someone is drinking more than the liver can handle. And if you had a biopsy done at that time, the liver would show a lot of fat, but without any inflammation. And that really is almost a universal finding on people's liver biopsies, just with any amount of what we considered heavy drinking, which was, again, more than 3 drinks a day for a woman, more than 4 drinks a day for a man. The interesting thing about fat in the liver is that it is completely reversible once someone abstains from drinking. And that's really the second point that I think is the most important thing to learn today, that early on, any effect that alcohol, any negative effect that alcohol has had on the liver can be reversed, and as just by abstinence. I know that's easier said than done, but that is really the key treatment in any alcoholic liver disease is abstinence. So once someone continues drinking, if they do go on to alcoholic hepatitis, that will occur in 1 out of 3 heavy drinkers. So it's quite often, but as I said, not everybody who has fatty liver will go on and develop alcoholic hepatitis. So alcoholic liver disease, when we talk about fatty liver, like I said, the liver biopsy can be indistinguishable from someone with non-alcoholic fatty liver disease. And these are people who suffer from the metabolic syndrome and have diabetes, obesity, hyperlipidemia. they will have biopsies that really are identical to someone who has none of those medical illnesses but is drinking too much alcohol. 8 to 20% of patients with fatty liver will go on to develop cirrhosis. And the things that are more predictive of going on to cirrhosis or put you at higher risk of going on to cirrhosis is daily drinking, which is more significant than if someone is periodically binge drinking. Smoking is an independent risk factor. Obesity is an independent risk factor. Female sex and superimposed liver disease such as hepatitis C or B, as mentioned earlier. All of those things will increase the chance that the patient will progress to cirrhosis. So another important thing about alcohol that I think most people don't realize is that it's highly caloric. It has a very high caloric density. And we think of fat as being highly caloric, and that has 9 calories per gram, but alcohol has 7 calories per gram, whereas protein and carbohydrates are just 4 calories per gram. So that means that your standard drink, what we said was 14 grams of alcohol, has 98 calories, your standard drink. And that doesn't include if someone's having a mixed drink, the excessive calories from the fruit juice or whatever is in the mixed drink. So we can see how those calories can add up. And it's important because forgetting about the alcohol itself, just the calories and can put fat in our liver. I'm saying that leads to obesity, diabetes, those things put fat in the liver. So it's very important to realize that alcohol just has a high caloric density. And so it's just an additional insult to your liver. So abstinence is the most effective treatment. No question that people who stop drinking can reverse all that fat in their liver. It can go back to normal. And that people who drink less, even if they're not able to stop, certainly do better than people who are drinking more. The next important item with trying to treat alcoholic liver disease is many patients are malnourished, and because they are spending time drinking and not eating properly. So a nutritional assessment is important, and replacing certain vitamins that might be like thiamine that might need to be replaced. People who are malnourished will have a much higher risk for a much higher incidence of mortality than people who are well nourished. And then there are several medications that have been studied to treat alcoholic liver disease, but as of yet, there are really no proven therapies. We'll go into that a little more later. Milk thistle is something that I think many people have heard about. It is an over-the-counter supplement, and it has been shown in studies to actually reduce the liver test, the liver enzyme test, to help lower those numbers. But if one were to biopsy the livers of people on milk thistle, it really has no impact on the actual liver disease, and it's not going to help get fat or inflammation out of the liver. Coffee, though, interestingly, has been shown in several studies to help halt the progression of liver disease, especially in people who have fat in their liver, and halt the progression of fibrosis. But it has to be a significant amount of coffee, at least 24 ounces a day. So that's a little aside, and has been one of those things that has surprised everyone. And then finally, the ultimate treatment for alcoholic liver disease, if someone has developed cirrhosis or a liver cancer, would be liver transplant. Now, patients who are going to be eligible for liver transplant typically have had to have abstained from alcohol for at least 6 months before they'd even be considered for transplant. So, as said before, alcoholic versus non-alcoholic fatty liver disease are really hard to distinguish and differentiate. And it really is just based on the patient's history. So talking to patients, talking to your family members, that's really how we know whether it's alcohol or whether it's more the metabolic syndrome. The biopsies can be similar, and just obesity itself does not help differentiate, because although it's certainly a known risk factor for non-alcoholic fatty liver disease, it also increases the risk of fat in heavy drinkers. So the next step in the progression of liver disease is alcoholic hepatitis. And this is really an acute presentation where the patient may have a fever, they can be jaundiced, they can have a big liver, a big spleen, they can have lost their appetite and really just feel poorly and really look poorly as well. They might have upper abdominal pain where the liver is in the right upper abdomen. They can also be confused and even have bleeding. So alcoholic hepatitis is typically associated with certain elevations in the liver tests, and these elevations can persist for quite some time. But the AST and the ALT are the things that are most commonly elevated. So with alcoholic liver disease, one thing we want to know, do we need to biopsy patients? You know, do we need to distinguish between other liver diseases? And so just in general, any patient who has abnormal liver enzymes for more than 6 months is considered to be someone who may need a liver biopsy. And the reason to do a liver biopsy in someone who we think has alcoholic liver disease there's a couple of reasons. One is just to be sure that there's no other comorbid disease at the same time, such as something like autoimmune hepatitis or even hepatitis C that had been undiagnosed previously. The other reason is to help prognosticate for the patient, because if we already see that there's significant fibrosis in the liver on a biopsy, we know that that patient is really destined to go on to cirrhosis. And sometimes that is necessary in order to really convince someone that they need to abstain from alcohol. So once again, what's the treatment for alcoholic hepatitis? This will come up over and over again. Abstinence is the most effective therapy. And then we have supportive measures, certainly treatment for alcoholic withdrawal. We have hydrating, trying to get someone better nourished, and then giving vitamins that are often deficient in people who have alcoholic hepatitis, thiamine, folate, pyridoxine. Magnesium is often low. And then vitamin K also often has to be given to help decrease the risk of bleeding. Sorry, I wanted to go. The other thing that has been used are steroids have been used to help alcoholic hepatitis. Other medications that have been used in the past have so far been proven to really not be helpful. So once again, abstinence is the most effective means to prevent alcoholic liver disease. Alcoholic liver disease is reversible, certainly when we're at the first stage of fatty liver. It can be reversed with alcoholic hepatitis. And once someone has cirrhosis, although all the scarring in the liver is unlikely to be reversed, certainly some of the scarring in the liver can improve, and patient might be downgraded from having cirrhosis just to having advanced fibrosis in their liver. So hence abstinence, abstinence, abstinence. Again, the most important thing you can take home from this talk, that one beer is the same as one glass of wine is the same as one hard drink. Those are the two things that I really want people to be very clear on. The next thing we want to do is a nutritional assessment. That is very important because people who are malnourished with alcoholic hepatitis have up to an 80% mortality within the first year, whereas people who are not malnourished or only mildly malnourished, it's much lower, about a 30% mortality. Counseling is certainly important. Things, Alcoholics Anonymous is a great organization that really has helped people become sober. Individual counseling, sometimes counseling for family members, also very important in order to get people to stop drinking. And then finally, referral to a transplant center. So once someone has progressed to the point of cirrhosis and their liver really is no longer keeping up with everything it needs to do, then we need to talk about liver transplant. And the transplant centers have, unfortunately, way more people who need livers than available livers. So typically with alcoholic liver disease, someone really will have to prove sobriety for at least 6 months to be considered for transplant. But once people have done that, certainly patients with alcoholic liver disease who undergo liver transplant do just as well as people who undergo liver transplant for other reasons. And finally, just to close with a cartoon, I'm serious, I literally cannot hold my liquor.
Thank you so much, Dr. Spivak. That was a very good overview of the whole issue of alcohol-related liver disease. We just want to end this webinar by alerting you to the American Liver Foundation's resources. We have a website, which you can see here. This is our Connecticut website. There's also the national website and a national helpline. So if you need any assistance or have any questions, feel free to call that 800 number and someone can assist you. We also have educational materials that you can download from our site, as well as the drug discount card that can be downloaded as well. So with that, again, thank you, Dr. Spivak. We're pleased that you were able to do this with us today, and thank you very much. This is the end of our webinar.